Everybody ready? Yeah? Well, good afternoon. Oh, and actually, we're outdoors, so I'm going to take off my mask. I'm very excited about doing that today. You really cannot beat this beautiful stadium. I am so excited to see the day when this place is filled with earthquake fans again, and that everybody's vaccinated and you can hear it at the top of people's lungs. This is an amazing place to be for a game. I know many of you have missed going to games, sitting outside in the beautiful bleachers. And today in Santa Clara County and the San Jose Earthquakes are announcing a partnership to help make sure that all of our residents can get here to cheer on the earthquakes. We especially wanted to need the earthquakes' help in communities that are hardest hit, because so many of our communities are manufacturers or nurses or teachers or janitors and grocery clerks, and we want to make sure that they get vaccinated. So we've been doing quite a lot to get people vaccinated. Let me just give you a little bit of background. One, we've been going door to door in the hardest hit communities. We've been doing pop-up clinics at shopping centers, churches, and schools. And now we're getting closer to the vaccination finish line. The earthquakes are going to help us get this kicked off for Memorial Day weekend this Friday. In partnership with the Quakes, we're having a vaccination clinic at Overfelt High School from 11:30 to 7:30, and there will be a big earthquakes presence there that you're going to hear about in a moment. Earthquake players are also making public service announcements to promote it on radio and TV. And I just wanted to acknowledge that our partnership with the earthquakes since COVID-19 has hit our community has been amazing. Jed Metee, the San Jose Earthquakes Executive Vice President, and the Earthquakes have really stepped up. I cannot share enough about this. And let me just give you some examples. Early on, they were one of the first groups who said, what can we do to help? They made sure masks were available. They gave us giveaways at some of our first pop-ups when we were still trying to figure out how to get people vaccinated. And I can't say enough how grateful I am to the leadership of Jed Metee and the Earthquakes. I also want to thank Oswaldo because I know how important he is, because my whole staff wanted to come today. That's always a sign, a good sign. And also I'm really excited to have Dr. Marty Fenstersheib with us, who hasn't slept since COVID started, trying to make sure people are vaccinated. So just a little bit of background and housekeeping. We're going to take questions from all of you, and then if necessary, we'll do one-on-one interviews, and also the language access team will be making statements from the podium for Q&A. So with that, I'm really just honored, and I think I get to start by introducing Jed Metee, whose home we're in today, and I just want to say again a very special thank you, and I want you to look at his beautiful mask. All right, Jed.
Yep. Mask, we're a great partnership with Valley Health Plan and the earthquakes. It's been going on for a number of years here, so we're really excited about that. And hopefully no airplanes come by while I'm speaking right during it. But first of all, I'd like to say thank you very much to everyone at the Santa Clara County offices, the Public Health Department, and everywhere for working tirelessly over the past year and a half to keep everyone safe, especially Supervisor Chavez working with us, and Dr. Fenstersheib coming out here and working with us on our return to play protocols, and working with all the different members of the community to help keep everyone safe. Luckily, over the past few months, the earthquakes have been able to host limited capacity games because everyone is adopting the vaccines and getting vaccinated at a good pace in the county. So we've had 5,000 fans at games here recently, and we've gotten the community back together to reconnect here in a small way, and it's been fantastic. We're here today to support the county as we continue to push for more people to get vaccinated and get more access to vaccinations. And we're excited to partner with the county again, as we've done throughout the pandemic. And we're excited to do so we can bring the community back together and also bring a full stadium back here to PayPal Park and at full capacity, which we're planning to do hopefully this summer. To encourage the community to get vaccinated and to make it more accessible to members of the community across all spectrums, we have a few great events. As Supervisor Chavez mentioned, this Friday, May 28th at Overfelt High School, we'll have Romero-Morales, one of our players who played for the Earthquakes from 1996 through 2013 was our team captain for many years. He's going to be signing autographs from 4:30 to 6 p.m. at Overfelt. We've also had Oswaldo and 2 other players, along with our head coach, Mettee Almeida, sign a number of jerseys that will be available for certain select winners at the event over the course of the day at Overfelt. So that some people that get vaccinated will have the chance to win an autographed jersey. And that'll be signed by Carlos Fierro, Chavez, Oswaldo, and Mettee Almeida. And soon we're going to announce another event right here at PayPal Park, a mobile vaccination event in conjunction with the county to help offer more access to vaccines. And we'll have some players at that event as well. We're working on the date, and that information should come soon. I'm going to introduce Oswaldo, but I'm also going to say what I just said in English, in Spanish, but a little bit more slowly so I can speak clearly and work on my Spanish. But gracias a todo el condado de Santa Clara County, Supervisor Chavez, Dr. Fenstersheib, y toda la gente que han trabajado tanto durante los últimos año y medio aquí en Santa Clara County. Han hecho un esfuerzo muy grande para apoyar toda esta comunidad y para que todos estén seguros y sanos. Los Earthquakes han tenido la suerte de invitar a la comunidad al estadio 5 veces este año para partidos. Hemos jugado 5 partidos en casa con 5,000 personas. Fue una oportunidad para conectar otra vez con la comunidad aquí local y algo muy importante para nosotros. Y estamos aquí hoy para apoyar al condado y en sus esfuerzos para que toda la gente aquí en este condado de Santa Clara se vacunen y que estén sanos y tengan acceso a las vacunas en varios sitios. Este viernes hay un evento en Overfelt High School aquí en San José, en Santa Clara County, para vacunación. Romero-Morales, un jugador de los Earthquakes que jugó varios años con nosotros como nuestro capitán, va a estar desde 4:30 a 6 de la tarde firmando autógrafos para la gente que lleguen para sus vacunas. También van a haber camisetas firmadas por Oswaldo Alanis, Marty Almeida, Carlos Fierro y Chavez, 3 jugadores de los Earthquakes y el técnico de los Earthquakes en este momento. Entonces, algunas personas que se vacunen el viernes van a tener la chance de ganar estas camisetas especiales. Y también vamos a anunciar dentro de poco un evento aquí en el estadio de PayPal Park para un evento de vacunación para gente de la comunidad. Y eso vamos a anunciar dentro de poco. Y ahora quiero presentar al defensa de los San Jose Earthquakes, titular, Oswaldo Alanis.
Right. Hey everyone. Thank you for inviting me to here to give a message to people. And first of all, thank all the people that is working hard for getting us vaccinated and all the work that you have been doing, and for us coming from another country that suffer different type of things, and being how you work here and how you make people being safe is for us something that we thank a lot, and I make it now. Also, the message of us is from the players, from all the staffs, from all the Earthquakes is from Hispanic people especially, get vaccinated. The vaccine is safe and effective. That's for something good for everyone, because we want to be here with all the fans in the stadium and supporting us. So I think if we help getting vaccinated and convincing the people that make it as soon as possible, we will have a better community and also better shows, stadiums, and different type of events that we can be together. I have been vaccinated. Also, I think most of the Earthquakes team, and we are safe. We are good. We are now making other things that we can do and feeling safe. That is the most important, I think so. Ahora en español, y bueno, gracias por la invitación. Agradezco para Aprovecho el momento para agradecer a todas las personas que están haciendo una labor muy fuerte para estar vacunados, para poder ayudar a tanta gente. Yo que vengo de un país en donde estamos sufriendo y tengo familiares que en estos momentos no se han podido vacunar y que es una situación difícil, le agradecemos a todas las personas que han hecho su labor muy fuerte para que en este momento tengamos la vacuna, tantas personas que lo han podido hacer ahora. Invito a mis compatriotas hispanos a que se vacunen lo más pronto posible, a que ayuden a que estos estadios, a que todos los shows y todos los eventos puedan estar pronto con gente, porque al final es por un buen común. La vacuna es efectiva, es segura, todos estamos en este camino buscando mejorar la sociedad y así podremos ayudar a que también haya más espectáculos y más shows. Yo ya me vacuné, mis compañeros también, y los invito a que lo hagan pronto. Gracias.
All right, Dr. Marty.
Okay, good afternoon. I don't think I've ever taken off my mask when I have spoken before, at least in the last several months, but I'm feeling good about the county. And first of all, on behalf of the Public Health Department, I want to thank the Earthquakes, Jed, and players, and we're happy to work closely with you as we have been all along. Just to give you a little bit of data and tell you where we are in this whole effort. First of all, the new case numbers in our county for COVID are really low, some of the lowest that we've ever seen. Our positivity rate is below 0.5%. That's extremely low. And these numbers, I think, prove beyond a doubt that vaccinations work. Nearly 75% of Santa Clara County residents have received at least one shot. That's a remarkable number, better than probably almost anywhere else in the country. Three out of 4 people, 12 years of age, again, that's the 75%. So 3 out of 4 people have at least one shot, and 6 out of 10 are fully vaccinated. 6 out of 10. But we still have disparities, as we've talked about. We need to make sure that those that have been hardest hit and most impacted by COVID have access and the ability to get vaccinated, and for that reason the county has been traveling to communities, bringing vaccines to these communities so that we don't have any barriers for vaccinations. We have given over 2.3 million shots already in our county, but we aren't done yet, and I think this is really important. Our goal is to get 85% with at least one shot by June 15th. That's when the governor plans to open everything up. We want to be ready. We want to be ready, and if we can make it to 85%, I think we can do it. To those who've been vaccinated, I say thank you very, very much. You have done your part to help provide safety and help us open up our community even more. To those who haven't been vaccinated, I say, please do your part. Don't depend on your friends and neighbors and other members of your family who have been vaccinated to protect you. And that's what's happening. Do your part, get vaccinated so that we can all be safe and open up our community in the next several weeks to months. It's easy to get vaccinated. As was said, it's safe and very effective. Just go to our website at sccfreevax.org and find a site near you. You can make an appointment or you can just drop in. I would say to the parents, bring your kids, bring your teenagers down. I would say to the teenagers, bring your parents down. I would say to employers, encourage your employees to get vaccinated for a safer working environment. And so for that, I will end. And again, thank you for all the work everyone has done. And we still have a little bit further to go, but I know we can do it. Thank you. All right.
I was looking at the state's public health vaccination rate data. They break it down by zip. There is a zip code in Palo Alto, Palo Alto Hills, that basically has reached nearly 100%, 86% fully vaccinated. And apparently
Yes. Again, there are parts of our county that have had good access and good motivation to get vaccinated. Sometimes those parts of our community that are better resourced in order to take advantage of the medical resources and vaccinations. Other parts of the county, as I mentioned, where we still see disparities, we have learned the one thing is to break down all the barriers, to break down all the misinformation, and we're hearing a lot of misinformation, especially in some of the communities on our east side and in our South County. So we have work to do there, and we're taking the vaccinations to the communities. We are signing people up for appointments. We have pop-up sites. We are taking the vaccines to the community. But we need the help from the communities, from people who live in the communities that have been vaccinated, that are leaders. Please help us in getting everybody up to the same rates that we have seen in some of those other more resourced parts of our community.
And just one quick follow-up, if I could. Reflect upon kind of the cruel irony of the fact that some of the communities with the highest infection rates conversely have the lowest rate of vaccination. Specifically, there's a pocket of East San Jose where about 14% of the people have been diagnosed with COVID, and fewer than half have been vaccinated.
Right. So that's the whole issue of disparities. We actually look at not zip codes, but census tracts, which are smaller community populations. And really, we only have a few, even on the east side, that are below 50%. So we're going door to door, as Supervisor Chavez said, to find people, again, that may, for whatever reason, have misinformation or who haven't had access. So we still, as I said, we still have work to do, but we can do it. And I'm hopeful in the next few weeks we will get to our goal. Thank you.
What do you think are the biggest barriers right now for the last group of people who have not been vaccinated? Is it misinformation? Is it lack of access? And how does this new vaccine site at Overfelt kind of target that?
Yeah, so a lot of issues. I think we have trying to do our best to deal with the access issues, to break down barriers. We have gone to schools. We continue to go to all the schools. In fact, I think we're going to have pop-up sites eventually at all of our schools for those 12 to 17-year-olds. As far as some of the misinformation, I mean, we're seeing that on social media. Supervisor Chavez and I were just talking about information that's not correct, that's showing up on TikTok. So again, we're trying to get the right information out, and also for the community that has been vaccinated and can provide some contrast to that misinformation on TikTok and some of the other social medias, I think will be very helpful.
Can I just follow up on that? I mean, I think part of the reason we're here with Oswaldo is that, you know, I think that there are folks who are going to feel confident because they know that this athlete got vaccinated and he's saying it's safe and he's healthy and he's, you know, he's well, I was going to repeat myself and say an athlete, but he's a soccer player. And you know, and part of the reason we're asking leaders like this is that we know there are people in the community who are going to hear this message from him differently than they hear it from Dr. Marty, or differently that they hear it from me, or even differently than they hear it from Jed. So that's the first thing. The second thing is that Santa Clara County is going to stay, we're in it to win it. Like we are at doors, and we're, you know, so here's what we learned. People don't like appointments, so just walk up. You can come to any location and we are going to take you. If you can't use your computer, dial 211. We will find a place to vaccinate you. We're even going door to door for people who are homebound using our fire services and other services, because we know to get to the number that Marty's talking about, we have to pull out all the stops. So as we are learning about those barriers, we're removing them as quickly as we can. Anybody else?
The county is set to receive millions of dollars in federal funding from this American Rescue Plan. What is that money going towards?
So the board is going through our budgeting process right now, and so I can't answer that specifically, but let me just say one thing I do know. In the County of Santa Clara, we took our county resources when COVID-19 very first started, not knowing what we were going to get paid back from FEMA, not knowing that the American Rescue Plan was coming our way, and we invested as much as we possibly could to make sure that we were testing people and that we were vaccinating people. And let me just remind you, if you go back to the early time of the pandemic, at that time, everybody was sort of looking at each other saying, you know, whose job is it? Is it the public sector hospitals? Is it the private sector? Is it all of ours? But what we did is we expanded our ability to provide not just the testing, but also the ability to process all those tests. So we have spent an awful lot of money through our 3 county hospitals, O'Connor, St. Louis, and Valley Medical Center, and in partnership with our own clinics, our community clinics, and the private sector hospitals. So one of the things that we have to make sure of is that we make sure that all of the resources we've invested, that we make sure we keep those in our healthcare system so that we're able to be robust and ready for 2 things. One, if we have another surge, which I'm hopeful that we won't, but the other is that we don't know how long these vaccines are going to last. And you know, I just still want to say, people, go get them. I don't want to discourage anybody from getting them, but what that means is that our public health infrastructure needs to be ready and on the alert to go. And so I'm certain that a big part of the investment is going to be in protecting those assets and strengthening them and expanding them, so for, you know, months and years to come, we're able to serve the people of this community in the most assertive, aggressive, health-focused way we can. We've already done some of that. So 2 things that the county's doing on that, actually 3 things that we're doing on that front. One is that we have a $100 million loan fund that's already got almost 400 applications, which I'm really excited about, coming from Santa Clara County. 2, that we're taking any of the resources that we would have gotten from permitting, because as you know, restaurants that have closed down have to be re-permitted and other things. And so we're not charging, if the stores are under, I think, 50 employees, they still have to get a permit, but we're not going to be charging them for that. And the other thing is the fines and forfeitures that we're getting from folks who flagrantly violated the health rules, all of that money is going to be given back to businesses in our community. So at the county level, we're very focused on making sure that using every lever we can to really support recovery. We recognize that a big part of the work of recovery, especially from an economic development perspective, largely is going to be housed with the cities, that much of our work is going to be both doing what we can to support the cities, but also making sure that we have the health infrastructure in place so we don't have another surge, so these businesses aren't forced to close again.
And a question for the supervisor, if I could. When I was looking at that census tract information and looking at communities that were under 50% vaccination, one of the big ones was right in the heart of East San Jose. Alum Rock, White Grove, Stewart, and I know that you're familiar with those areas. What do you think's going on? It's 48%. I mean, I know that there has been a push to get people in those areas vaccinated. What is the chief obstacle? What is the thing that's holding that area back from taking advantage of
Yeah.
the resources?
So it's a great question, and I was really struck by Oswaldo's comments about, you know, how, you know, Mexico, India, Brazil, and other countries are really struggling, and what resources and assets that we have, you know, to bear in our community. And, you know, so what I would say is that from talking to folks directly about why they're not getting vaccinated, some is a concern about missing work. We have a lot of low-income folks who can't really afford to have a dip in their paychecks, especially now that they're able to go back to work. Second, transportation. Third, childcare. And so part of our obligation, I think, is to figure out how best we can really serve these communities, and making sure that people aren't so fearful of losing a job or not having food on their tables or missing the ability to get a prescription. I mean, we are really talking about the lowest income communities with highest needs. So we're talking to folks, and my hope is that by putting these places of vaccination literally on people's doorsteps, that we're going to have a much better shot at getting people vaccinated. I do just want to tell a quick story about that. Councilmember Magdalena Carrasco hosted a vaccination location in one of these really hard-hit census tracts. The second vaccine was to be delivered on Mother's Day. So just imagine that for a moment, that you go out, you get everybody, as many people as you can, vaccinated. They went into the Foxdale neighborhood. They were literally going door to door, getting people to come out. So on Mother's Day, they had mariachis, burritos, and they vaccinated almost the same number of people to get their second vaccine, and they got for the people who didn't show up for their second vaccine, which was a really small number, they got brand new people vaccinated. That's the kind of energy and focus that we're going to have for all of our communities. Thank you. Any other questions? No? Well, thank you all very much. I know we're going to get to the next set in Spanish, which is really critical, so I'm going to move out of the way. And I do want to just say again, my sincerest thanks to the Earthquakes, and Friday night is going to be a blast, and thank you so much for being here. All right.
Muy buenas tardes a todos, mi nombre es Ricardo Romero-Morales, soy oficial principal de Información Pública para el Condado de Santa Clara. Esta tarde estamos anunciando que gracias a las bajas tasas de COVID-19 que hemos estado viendo aquí en el Condado de Santa Clara, esto nos está dando una nueva oportunidad. También estamos viendo que las tasas de positividad aquí en el condado están bajo el 0.5%, lo cual son excelentes noticias y las cuales no habíamos tenido desde hace mucho tiempo, ya casi un año. Ahora, también sabemos que estos números lo que nos indican es que las vacunas funcionan. Y esto es evidente porque la mayoría de las personas que vivimos aquí en el condado de Santa Clara ya recibieron al menos la primera dosis de la vacuna. Aproximadamente el 75% de la población ha recibido al menos la primera dosis, lo cual es aproximadamente 3 personas entre 4 personas quienes ya se vacunaron y que tienen de edad de 12 años o más. También sabemos que al menos 6 de cada 10 personas ya está completamente vacunada. Esto quiere decir que aproximadamente 2.3 millones de dosis han sido distribuidas aquí en nuestro condado. Pero más sin embargo, todavía nos falta trabajo que hacer para seguir vacunando a todas aquellas personas quienes aún no se han puesto la vacuna. Nuestra meta como condado de Santa Clara es llegar al 85% a mediados del próximo mes de junio. Gracias a todos ustedes quienes ya se pusieron la vacuna. Gracias a todos ustedes por hacer de su parte. Mas sin embargo, si aún tú no te has puesto la vacuna, te invitamos a que te pongas la vacuna y que hagas de tu parte. Hay que poner todos un poco de nuestro granito de arena para salir de esta pandemia. Sabemos también que gracias al esfuerzo que estamos haciendo y el trabajo que estamos colaborando con diferentes agencias organizarias, también tenemos y estamos trabajando con los Earthquakes de aquí de San José, y estamos también anunciando el día de hoy un evento el cual tomará lugar el día 28 de mayo, el cual es este viernes que viene, en la preparatoria Overfelt. Este evento estará de 11 de la mañana a 7:30 de la noche, en el cual estaremos rifando camisetas autografiadas por algunos de los jugadores de aquí del equipo de los Earthquakes. También tendremos a Ramiro Corrales, quien estará firmando autógrafos de 4:30 a 6:30 de la tarde. Así que por favor, si ustedes no se han puesto la vacuna, esta es una excelente oportunidad para que ustedes vengan, traigan al amigo, traigan a la novia, a la comadre, a la tía, para que se puedan poner la vacuna. Gracias.
Hola gente, ¿cómo están? Saludos a todos por ahí. Contento de estar aquí, de poderlos invitar. Realmente toda la parte de San José estamos muy agradecidos con todo el trabajo que se está haciendo para el tema de la vacuna. Personas que venimos de afuera y que estamos viviendo la situación de no tener tanta facilidad para estar vacunados, para nosotros es algo que agradecemos mucho y que de verdad yo los invito a todas las personas, a toda la comunidad hispana, a todos mis paisanos, a que se vacunen lo más pronto que puedan, a que inviten a esas personas que no se han vacunado, porque al final es un beneficio para todos, es para el bien de nosotros tener gente aquí en los diferentes shows que se pueden presentar, tanto como es el fútbol como muchos otros. Y nosotros estamos haciendo nuestra labor, estamos trabajando, nos hemos vacunado todos los jugadores que hemos podido. Habrá unos que les falte la segunda dosis, toda la gente también del equipo está realmente trabajando en eso. Entonces agradecerles a todos los que están haciendo esa labor, invitar a toda la gente para que se vacunen porque eso nos beneficiará a todos. Gracias.
Okay, and we will now move into the Vietnamese portion of this press conference.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay thì quận hạt Santa Clara đã mở một buổi họp báo để đưa đến cho quý vị một thông tin là các viên chức Sở Y tế quận hạt đã cùng phối hợp với đội bóng San Jose Earthquake đã mở một thông báo, đã mở một sự kiện về việc tiêm ngừa vào thứ Sáu tuần này là vào ngày 28 tháng 5. Là từ 11 giờ 30 sáng đến 7 giờ 30 tối tại Overfelt High School. Những ai tiêm ngừa vào thứ Sáu tuần này tại trường trung học Overfelt sẽ có cơ hội bốc thăm trúng thưởng một áo thể thao đồng phục có chữ ký của các cầu thủ trong đội bóng San Jose Earthquake. Kính thưa quý vị, tỷ lệ dương tính với Covid-19 trong quận hạt đã ở mức thấp nhất là 0.5%. Con số này đã chứng minh được là nỗ lực tiêm ngừa của chúng ta đã đạt hiệu quả. Hơn 75% cư dân hội đủ điều kiện tiêm ngừa trong quận hạt đã được tiêm ngừa ít nhất là một liều vaccine Covid-19. Và trong các cư dân được hội đủ tiêu chuẩn tiêm ngừa là từ 12 tuổi trở lên thì cứ 4 người thì đã có 3 người đã được tiêm ngừa vaccine Covid-19. Tính đến thời điểm hiện tại thì quận hạt đã đưa ra 2,3 triệu liều. Mặc dù nỗ lực tiêm ngừa đã có nhiều kết quả đáng khích lệ, tuy nhiên chúng ta vẫn chưa dừng lại. Mục tiêu của quận hạt là sẽ tiêm ngừa cho 85% cư dân ít nhất một liều vào giữa tháng tới. Những ai đã tiêm ngừa rồi, chúng tôi chân thành cảm ơn quý vị đã thực hiện bổn phận của mình để bảo vệ cộng đồng và ngăn chặn sự lây lan. Đối với những người chưa đi tiêm ngừa, tôi chỉ có thể nói rằng quý vị hãy đi tiêm ngừa khi có cơ hội. Đừng phụ thuộc vào những người đã đi tiêm ngừa rồi mà nghĩ rằng quý vị không cần tiêm ngừa cũng được. Ngay thời điểm này, hãy đi tiêm ngừa khi tất cả những cái cơ sở tiêm ngừa đang được mở rộng và giờ làm việc cũng mở ra được linh hoạt hơn, rất tiện cho quý vị được đặt hẹn và cũng như là đi đến những địa điểm không cần đặt hẹn. Quý vị có thể tìm thấy lịch đặt hẹn tiêm ngừa cũng như là những cái lịch tiêm ngừa không cần đặt hẹn ở trên trang mạng của chúng tôi là ở scc.freevax.org. Tất cả các loại thuốc ngừa được FDA phê duyệt đều an toàn và hiệu quả. Nếu quý vị có bất kỳ câu hỏi nào liên quan đến tiêm ngừa COVID-19 thì quý vị có thể gọi vào cái tổng đài về tiêm ngừa COVID-19 của chúng tôi ở số 408 970 2999. Một lần nữa, quý vị hãy dẫn con em của mình đi tiêm ngừa. Các em nhỏ từ 12 tuổi trở lên đã hội đủ tiêu chuẩn tiêm ngừa. Và các chủ doanh nghiệp cũng hãy khuyến khích nhân viên của mình đi tiêm ngừa. Và tất cả chúng ta sẽ cùng nhau thoát khỏi đại dịch này sớm hơn. Xin cảm ơn quý vị. And now, Anh Chang will provide statement in Chinese.
大家好，我是圣塔克拉拉县紧急行动中心的 Chang。今天的记者会主要是宣传在这个星期五在 Overfelt 高中所举办的疫苗接种的特别活动。这个活动是和本地的美式足球圣荷西地震队合作，希望鼓励更多年满12岁尚未接种疫苗的居民去接种疫苗。圣荷西地震美式足球队 San Jose Earthquakes 了解被疫情影响最严重的社区。在此疫情期间，不遗余力地为减缓大流行做出了努力。虽然在圣塔克拉拉县已经有超过100万的居民完成了疫苗接种，但是在准备社区完全开放之际，越多人完成疫苗接种，才能够保障社区的健康与安全。我们的目标是在下个月达到85%，至少1剂疫苗的接种率。尤其是进入暑假第一个长周末的国殇纪念日即将来临，如果您和家人朋友想要能够更安心的出游或者是活动，我们鼓励您尽快去接种疫苗。我们需要大家的努力来达到全民接种疫苗的目标，而年轻学子要能够更安全地参加毕业典礼以及毕业舞会等大型的活动，接种疫苗才能够更有效地保护自己及家人朋友，降低染疫的机会。毕竟有健康的身体，才可能有光明的前途。在活动当天去接种新冠疫苗的人都有机会能够摸彩，获得球员签名的球队运动上衣。 活动是在这个星期五上午11:30到晚上7:30，在 Overfelt 高中，地址是1835 Cunningham Avenue San Jose。希望家长能够带着年满12岁尚未接种疫苗的孩子来打疫苗，而雇主能够鼓励员工一起来参与。更多疫苗的讯息还有日期时间，请上圣县的疫苗网站 sccfreevax.org， 或者是打电话到408-970-2999。更多新冠的消息与更新，请上圣县的网站 www.sccgov.org/covid19。最后，祝大家平安健康。Now Jimbill will be providing the statement in Tagalog. Thank you.
Magandang hapon sa lahat. Ako po ay si Jimbill Batuampo, Public Information Officer ng Santa Clara County. Nandito po tayo ngayon sa PayPal Park upang i-anunsyo na ang San Jose Earthquakes ay tumutulong sa Santa Clara County sa pagbawas ng mga hadlang sa pagbabakuna ng mga komunidad na lubos na naapektuhan ng COVID-19. Ang San Jose Earthquakes Defensive Center back na si Oswaldo Alanis, isang sikat na Mexican professional footballer, at San Jose Earthquakes Executive Vice President Jed Metee ay sasama kay Santa Clara County Supervisor Cindy Chavez at Dr. Marty Fenstersheib, COVID-19 Testing and Vaccine Officer ng Santa Clara County, upang tumulong sa pagtaguyod ng isang araw na klinika sa pagbabakuna sa Overfelt High School sa Biyernes sa Mayo 28 mula 11:30 ng umaga hanggang 7:30 ng gabi. Ang San Jose Earthquakes ay nakikipagtulungan sa county para makapunta ang marami sa mga mahirap na maabot ng mga residente sa Overfelt High School na klinika hanggat maaari, habang magsisimula ang weekend ng Memorial Day. Ang Overfelt High School na klinika ay magkakaroon ng mga aktibidad ng San Jose Earthquakes. Ang mga tatanggap ng bakuna sa COVID-19 ay ipapasok sa isang raffle para mapanalunan ang isang autograph na jersey. Lahat ng mga jerseys ay napirmahan ng earthquake coach na si Matias Almeida, Oswaldo Alanis, Carlos Fierro at Chavez. Ang pinakabagong impormasyon tungkol sa kwalifikasyon at pamamahagi ng bakuna ay makikita sa sccfreevax.org. Maraming salamat.